The hip bone, also known as the coxal bone or innominate bone, is a large, irregular bone forming the lateral part of the pelvis. Each hip bone is formed by the fusion of three bones, the ilium, ischium, and pubis, which unite around the acetabulum, the socket for the femoral head. Broad, flaring portion of the hip bone. Its upper edge forms the iliac crest, a palpable ridge that extends from the anterior superior iliac spine to the posterior superior iliac spine. It serves as an attachment site for abdominal and gluteal muscles. Ischium. Located posteriorly and inferiorly, the ischium forms the lower and back part of the hip bone. It includes the ischial spine, ischial tuberosity, and the ramus of the ischium. The ischial tuberosity bears body weight when sitting and provides attachment for hamstring muscles. The pubis lies anteriorly. It consists of the body, superior ramus, and inferior ramus, a cartilaginous joint. The pubic crest and pubic tubercle serve as attachment points for abdominal muscles and ligaments. Acetabulum. This cup-shaped cavity on the lateral side of the hip bone articulates with the head of the femur to form the hip joint. It's bordered by contributions from all three bones, ilium, ischium, and pubis, highlighting their fusion. Obturator foramen. The large oval opening created by the ischium and pubis. It allows the passage of nerves and blood vessels, and is mostly covered by the obturator membrane. Clinical notes in description.